Hello and welcome to Holistic Flow. I'm your host, Julie. I'm an astrologer, coach, and founder of Wild Radiance Collective. And today I'm joined by Alice Smith, a women's holistic health coach. And I am so thrilled that you are here with us today. Alice empowers busy female professionals and business owners to optimize their health for greater success in both business and life. As a holistic health coach, Alice specializes in stress management, burnout prevention, energy management, and hormone health. Thank you so much for being here today.
Hi, Julie. Thank you so much for having me here today.
I can't wait to hear about everything about why you got into this work and what you're so passionate about. I certainly, as someone who's interested in your work, have so many reasons why I know it is helpful to me and to my clients and things. And I'm really excited about the workshop that you're going to be leading at Wild Radiance Collective this month. So tell us more about you and your work.
Yes, I am so excited about the workshop as well. I'm sure we'll talk about that in just a little bit. Yeah, you're exactly right. I am a women's holistic health coach, and it's a big title, but what that basically means is I help women reach their optimal health by looking at the full picture. So together we will assess their symptoms as well as their lifestyle as a whole to figure out what their body might be trying to tell them and what aspects of their lifestyle that maybe they could tweak or aren't serving them in reaching their optimal health and maybe the reason of these unwanted symptoms that they're having. So a holistic practitioner is basically trained in disease prevention and creating optimal wellness, um, as opposed to, for example, a doctor who is trained in disease treatment and medicine. So I think it's really, really important to distinguish between the two types of the two areas and really think about what practitioner it is that someone needs and is going to be the most help to them, because I think a lot of the reason why I'm in this work myself, that the kind of story that I've been through with my health and with doctors and with the healthcare system, and the stories that I hear from the women that I work with, my friends, my family, my story is definitely not unique. It's very common, but there will be a symptom that comes up. So, for example, um, you're experiencing painful periods, and you'll go to a doctor who has a 5-10 minute session with you. I know that's how it is here in the UK. Anyway, they have a 5-10 minute session with you and a doctor who has done their whole degree in medicine. That's what it's called. They are trained in medicine. They're not trained in doctor, they're trained in medicine. So they give you medicine because that's what they're good at. That's what will help suppress that symptom that you came to them complaining about. And they say, I can fix that symptom. Here's some medicine. But then you'll take that medicine, suppresses that symptom. Great. A year later, you're back at the doctor because you're experiencing extreme fatigue. And the doctor goes, I know exactly what to do about that. Here's some iron supplements. That's going to help with that symptom. Fine. They've given you that medicine. And then a year later, you go back and you have acne and they give you Roaccutane or medication for the acne. But the thing is that doctor doesn't have the time, and they'll be the first ones to tell you as well. They don't have the training to look at actually the underlying cause. They're not going to go through your whole nutrition history, your stress, your sleep. They may be able to ask you a few quick questions, but it's going to be very difficult for them to look at that as a whole, look at your symptoms as a whole, rather than kind of playing whack-a-mole with each one as it comes up. They're not really going to go, oh, but a year ago you actually came with this symptom. And then it's, that's the difference between a holistic practitioner that's going to help to prevent disease and improve your wellness and your health as a whole, rather than a doctor who is essential and necessary to treat a disease and to save your life when it comes to it. So yeah, that was a long-winded way of explaining what a holistic practitioner is.
That's perfect. I think it was really well said, and I really you hit on so many really important points along the journey of the experience as a patient or a client, depending on who you are
Hmm.
going for those services. And I think that you the thing that really summed it up for me, my favorite part, and the part that causes me so much frustration as a person. I'm actually seeking healthcare for some things that are going on right now.
Hmm.
Is that they don't look at all those things. Like you're seeing this doctor for this, you're seeing this doctor for this doctor for this. And while they're aware of these things, it feels like it takes far longer for that information to come back to
Hmm.
center base and like really meet up and start to match. And even then, they miss some of the important context of why that could be related. And
Yeah.
our bodies have been broken up in so many little pieces that the doctors can only manage those little pieces that they've been assigned, and then to give you medicine or to give you
Yeah.
to another doctor of medicine or things like that. And I love how you said I can't remember how you said it, not they're not a doctor of a doctor, they're
They're not trained in
medicine,
doctor.
they're not trained in doctor, they're trained in medicine. And that was
Yeah.
brilliant, because I that's life changing when you're working with somebody with a holistic view versus a medicine or healthcare view, especially when
Hmm.
you're considering treatment versus prevention. And
Yeah. And
that's incredible.
I in no way am saying that or lessening what doctors do. I work alongside doctors in a medical center. I've studied with doctors alongside them at uni, and both are needed, basically. Both are needed. If you're experiencing symptoms, always go to the doctor to get tests to rule out anything nasty, but then understand that, okay, we've ruled out something nasty. That symptom is not the problem. The symptom is not the problem. The symptom is the communication, the message from your body that there is something that's not quite right. And the person that can help you understand what that is would be the holistic practitioner.
Yeah, that's fascinating. So how, when they come to you, or tell me, either when your work setting or in your private practice, like, where do you begin? How do you begin with that?
That is a really good question, because every client is different and individual and may be coming to me at different stages along their health journey. Um, but the way we start, and the first thing that's really, really important, I guess, is just to understand what they view as what would be their optimal health, and what it is how they feel at the moment that they view is not at that stage. So the discrepancy between what they view as their optimal health and where they're at the moment, to understand what their barriers are, what symptoms they are dealing with, and where they would like to be. And then it is going to be, it's not a quick overnight process, which medicine could be. Medicine's that quick fix, but if you actually want to address the underlying cause, the root cause, it's really not a quick fix. So it will be, doing a bit of an audit of their lifestyle at the moment, really looking through their nutrition, their sleep habits, assessing their nervous system health, um, understanding what their blood sugar profile might look like throughout the day, looking at their symptoms and thinking, are any of them linked to any mineral deficiencies, for example? Um, and once we get a good picture of all of these and understand the person's lifestyle in terms of what they do for a job, how much free time they have, what areas they feel they can focus on first, that's when we start to make a plan. And it does really start quite slowly, which I know is not what people want to hear, but when people are really, really dedicated to actually making a long-term change rather than just a quick fix, it's the route that they need to go down. And it's um, getting feedback as well. So we might try something and we either get feedback from data. So one of the data that I use is measuring a person's heart rate variability, which is basically their health and the balance of their nervous system. So it tells me how much time they've spent in stress and fight or flight compared to how much time they've spent recovering and repairing and resting. And is there a good balance between the two? And often what we see at the start when I first work with a client is that for some reason their fight or flight outweighs their rest and recover. And we need to figure out, is that due to just lifestyle? Is it because they're lacking nutrients in a certain place? Is it due to their sleep habits? So it's a bit of trial and error, but we do get data back that is like real time data, because you could get a daily reading. And okay, look, you did this yesterday, and look at the effect that that had on your nervous system health. How did that affect your energy? So there are there's lots of ways about it, and different things that we track. Menstrual cycle being, or it depends on what phase of life the person I'm working with is at, but menstrual cycle being a really, really important tool to track someone's health as well. So yeah, there's no one specific answer to your question. I think it is different for each client.
Yeah, it is that true holistic view, but you are bringing in those pieces that always cause me concern that are going to get lost in,
Mm-hmm.
in the cracks when you're going to get your care. And like, it is important. If people do want the long-term results, they have to do the long-term work. And,
Mm-hmm.
our bodies didn't just, they usually, under most circumstances, didn't just get to this certain place overnight. It took time to get there. So it took time to get there. So then it takes time to unravel and heal from that
Mm-hmm.
as much as you can. At certain points, as you know, like the doctor is really needed because
Yeah.
for whatever reason, there's where, we can continue doing this holistic work, but then also there's this other thing that is now going on and isn't easily resolved, or has to have a different type of long-term management. And I I think this is fascinating. I'm not familiar with if we have somebody in our role, like I'm sorry, in your role in the United States. And I'm actually going to be looking that up when we're done recording, because it feels a little bit like um that bridge between what a doula would do during a birth. And the while you although you are using a lot of data and a lot of these healthcare tools, which is fascinating. I'm totally fascinated about your data. But even doulas aren't recognized or like wildly accepted as much in the United States as they could be. It's grown and changed a lot. It's far more accepted. It's far more common.
Mm-hmm.
But that's where I draw the connection of, I wonder if there are holistic practitioners like you working here in the United States. And I honestly just don't know.
I think the kind of cheat code that I have is that I trained in physiology. So I have a degree in health and wellbeing physiology, which pretty much is holistic healthcare, holistic coaching. But it's got that kind of official title that is used in hospitals and is used in medical practices. So my qualification is physiology. And then I've branched out, because even physiology, what we're trained in physiology doesn't look into, it's definitely branching out. And I'm part of a research project at the moment that is looking specifically at physiology in women's health and menopause and menstrual cycle and pregnancy. So we definitely is branching out, which is really, really, really exciting, and I'm really happy to be a part of that. But yeah, I think that's kind of my cheat code, in that how I do work alongside practitioners, it's alongside doctors as well. But yeah, you're definitely right in that it's so important to also work with your doctor, because they can rule out anything nasty, but one thing I really find important, and make sure that I do with my clients as well, is that make sure that they understand the reason behind everything that I ask them to do, or that we get them to do. And I think, again, that's just somewhere where doctors don't necessarily have the time to do that. They don't have the time to explain how the medicine they're giving you works, or what it kind of does to prevent or reduce your symptoms. And yeah, going back to part of my story with doctors, there's been different aspects, probably all linked in some way, definitely all linked in some way. But a big reason behind what I do and a reason behind the workshop that I'll be doing on menstrual cycle awareness is that I went to the doctor when I was 14 years old with painful period cramps, and the doctor 5 minutes later said, here's a prescription for the pill, the hormonal birth control, that will help to control your painful periods. So it did. I went on the pill at 14 years old, and my painful periods went, and it was amazing. And then when I wanted to start using birth control for actual preventing pregnancy, I wanted to switch to using the implant because I thought it was more reliable. It didn't rely on me taking a pill at the exact time each day. So I switched to the implant. Again, just went along to the what's it called? Like the sexual health centres that we have in the UK, and they were like, "Yeah, here you go. Here's the implant." And I'd stopped taking the pill, but then the implant made me have my periods go all over the place. I didn't know when I was going to bleed. So I started taking the pill alongside the implant to control my periods. And knowing what I know now about how important our natural hormone cycles are and how the pill and the implant work by providing you with synthetic hormones, and the fact that I was on both of them at the same time for 5 years terrifies me. But the thing is, I wasn't told. I was ignorant. I was very ignorant. I didn't look into it myself. I wasn't told what the pill did. I wasn't told what the implant did. I was just told this will control your periods and this will stop you from getting pregnant. So I was like, sweet, sorted. I'll use
Right.
both. Yeah, so I was on the pill for 11 years. I was on the implant for 5 of those years at the same time. And then I was actually quite deep into my holistic healthcare journey. I was working as a physiologist in a medical center. I was working as a health coach. And I still hadn't really put two and two together about how important my natural hormones are and my menstrual cycle were in terms of keeping me healthy, but also telling me about my health as being like a receipt or a scorecard of how healthy I really was. And then I started looking a bit more into that. I came off the pill in 2022. And unsurprisingly, I had very painful periods. I had extreme like PMS anxiety. So a whole week before I came on my period, I had mood swings. I was really sad. I could cry at anything. And then the 2 days before I came on, I was so anxious it affected how I could breathe. And I was thinking, I thought I was healthy. I eat right, I exercise right, I thought I was healthy, but my period, these symptoms are telling me something is wrong. Or something's not quite right, something needs tweaking. And it was then that I looked into menstrual cycle awareness and understanding how I'm meant to feel at each phase of my cycle and tracking this and understanding my individual mood changes, energy changes, social life changes throughout the cycle, and using menstrual cycle awareness and using my symptoms and my period as like this receipt or scorecard for my health that month, that I've been able to go, okay, if I tweak this here, if I rest a bit more here, if I make sure I've got meetings and social activities in here, but make sure I've got, a clear diary on this day, then the next month I'm happier, I'm more energized, these symptoms pretty much completely vanish. So yeah, I guess this is kind of moving on to the workshop that I'm doing. But
I'm starting to get so excited to ask you questions. I was like, oh my gosh, like tell me more. I'm like, this sounds like, yeah, tell us more.
yeah, the amount that it has literally changed my life for the better. One, because it has really reduced these symptoms and I don't have that anxiety. I don't have those painful periods, those mood swings. But two, because I'm now actually using it to elevate my life and the way that I work and the way that I communicate with people. And it's understanding my cycle has helped to improve my relationships with people. It's made me feel more confident, more comfortable. So yeah, that's my workshop on menstrual cycle awareness that we're doing on the 27th of January.
Yeah,
I think
27.
it's 2 p.m. Eastern time. 7 p.m. UK time. Uh, that's my mission for it, really, is to make all the women that come to that workshop as excited and feel as in love with their cycle as I am, and just feel empowered to take what they learn and use that as a tool to, one, improve their health, improve their well-being, because we'll go through nutrition and exercise and recovery and nervous system health, and how you can use that at each different phase of your cycle to improve your health as a whole, reduce those symptoms. But also how you can use it in life and with energy and relationships and work, and how everything is so linked together and it's just so magical. Just like the woman's body works, if that doesn't amaze you and like make you like feel obsessed with it, then I think you don't know enough about it, because it's unreal. So that's my mission for the workshop, is to make people as passionate about it as I am, and also give them practical tools to go away, track their cycle, understand how they can use that to kind of maybe plan their diary. And it's also going to be really helpful for people that don't necessarily have a regular cycle. So for people with PCOS, for example, or even people with endometriosis who, they experience extreme symptoms at their period, and throughout their cycle. And it can be used to help understand where you are at in your cycle, even if you don't have a regular cycle, and also hopefully to reduce those symptoms that you are getting, even if it is endometriosis, and even if it is that really serious. Hopefully the knowledge that they'll gain will really help to improve that, basically.
And feel your enthusiasm and passion like so much. Like I can, like I feel like I've been empowered even just learning this little bit like of a okay, and I'm taking mental notes because this is something actively going on in my life that I am actually working on. Having you focus on this topic feels very serendipitous for me. It feels really exciting, and I know for one that I will be leaving this workshop um, like hopeful and like inspired, definitely empowered. I can feel that. I definitely feel like eager. I've become in this little few minutes that you've told me, I'm feeling so excited for this workshop because I some of the doctors have been throwing around words like endometriosis and things like that for me. So when you speak to that, it's not something that I've been hearing from all doctors. It's which is
Hmm.
interesting. And I'm finding I've been learning so much about OBGYN care and everything over my lifetime, but definitely once I started having children,
Hmm.
you really learn about that. And I like how your work is so practical and so strategic and data driven. And it also feels so healing, like not just like it feels heart healing. It feels, soul healing.
Hmm.
Um, because I do also agree that you know, the menstruating body, the people that identify as female and want to have children and that childbearing power, that is one of the most transformative experiences of in my entire life.
Hmm.
And I completely agree that it's just magnificent and mind blowing and
Yeah.
something that it's so good that we're returning to. I'm so excited for you and everybody else that gets to work with you learning this because we need more of this. This is not no longer taboo. Like this is
Mm.
important. It needs to be in the forefront.
It is powerful. The energy changes, like the effect that it has in your body. The research studies that are being done on women or like people who menstruate at different phases in their cycle, the things that they're finding are mind blowing. Like people walk differently, they have a different energy, they attract different people think differently about that person, and that person thinks differently about the people around them just because of what their hormones are doing. And it's so powerful that we need to understand that power to then like harness it and use it to our advantage. Otherwise, it's almost like I heard a metaphor that said, you're going on an adventure. I'm saying you're going to go look at this amazing landscape. It's got woods, it's got mountains, and you're going to go on a hike. But I'm going to put a blindfold on you. Off you go. And
Oh.
that's yeah, that's really scary. You're going to get lost. You're not going to be able to see the beautiful landscape. You're not going to know where you're going. You're probably going to end up tripping up, hurting yourself a bit. You're going to be unhappy. That's almost like what it's like to go through your menstruating life, or even past that as a woman, not knowing what's going on and not knowing how those changes are going to affect you. And it's almost like learning that and becoming aware and using that to your advantage is like someone taking off that blindfold and you being able to go on this hike completely prepared with a good vision, and also be able to stop and appreciate the view. And
Such a good analogy.
that's kind of how it feels when you can really, and you can love your cycle. And people think about their cycle as something they need to be embarrassed of, ashamed of, they need to hide it, they need to pop painkillers or even hormonal birth control to control it. But if you appreciate the power of it, understand that we need these different phases throughout the month to be able to bloom and be at our best, and use that to your advantage, then you really, really can learn to love it.
Wow. Yeah. Without even knowing all the details, I can feel it. Like I have a question. So my mind
Yeah.
is struggling with thoughts. In general,
Hmm.
somebody that's moon attuned can often have their cycle line up with the moon.
Hmm.
Now, let's say, and you can correct me because I'm kind of just making a generalization, and you might be able to say, well, that's actually not this.
No,
Is it
go ahead.
is it possible for someone, even if they are moon attuned, to not have a cycle that lines up with, starting at one phase or another? How does that connect? I'm dying to know, because as somebody who really wants to implement these things that you're going to be teaching, like very much
Hmm.
so. I also am very attuned to the moon, and I work with the moon.
Yeah.
So how do those things connect? What do I need to know?
I think there is something there 100%. And for people that don't necessarily have a natural cycle, or maybe people that are post-menopause or have had to have their, have had a hysterectomy, for example, um, one bit of advice given to them is that they can use the moon as their guide through for their cycle, and use the different phases of the moon and link that to the phase of the cycle. And just a caveat, I think that in itself is so beautiful and so telling to the power of this cycle that we have, because you can overlay so many cycles in nature over the top of the menstrual cycle, and it just kind of mirrors it. So it's just so how it just kind of reflects how at one and in tune the female hormones are with nature itself, which I think is amazing as well. But in terms of, so do you mean with your question that if you are also following the cycles of the moon and using that to kind of guide your energy and your emotions, but your menstrual cycle doesn't quite match up, what's the best thing to do there? Is that kind of what you're asking?
Yeah, because I know at different times in my life, or between pregnancies, things like that, there's been shifts. So sometimes, and I actually don't know from a menstrual cycle perspective, like what the timing would be, except I thought, I thought if your cycle aligned with the full moon, that you were, oh no, that's a folk myth. Disregard that. I don't even, I think that's a folk myth. I think it would start with the new moon.
Yeah,
Is
so day one of your cycle, the day that you start your period, would be aligned with a new moon, and then ovulation around a full moon. If you were to use the moon as your guide, I think you need to. I think it's just a case of taking it. One of the major messages to this kind of menstrual cycle awareness is that everyone is different, and only you are going to know how you feel at each phase of the cycle. So, for example, at ovulation, some people it's their best time. They feel like a girl boss. They can get all their work done. They're sitting in meetings. They're smashing it. They've got all the energy. But I know for me that the day I ovulate, I'm getting no work done. My energy is too high that I cannot sit still. I need to be out talking to people. I need to be running around. I cannot sit at my desk. That's actually a little bit of it could be viewed as a weak point for me because I can't get done what I need to get done. But because I'm aware that that's how I'm going to feel on that day, I can use that to my advantage and look at my diary and plan around it, for example. So I think if you do follow the moon cycle and the energy with the moon, I think it's understanding that, okay, your hormones, the moon might be at full, but your hormones might be quite low. So your energy, according to your hormones, is going to be this, which only you will know after tracking for a few months. The moon is going to be affecting you in this way. It's probably quite complicated. I don't know why I struggled with that word. Complicated, but I think it's just going to be a case of understanding your cycle, understanding exactly how you feel at each phase, recognizing the patterns, and then also recognizing the effect that that moon has on you and how that might affect how you feel in that phase. So it's a trial and error, I'd say.
And that's a great answer. I think, and I like that the main point that it comes back to is really that self-awareness and that empowerment that you want, and to be drawing the conclusions between the different ways these things bring in is really helpful
Mm-hmm.
too, because something you said a few minutes ago was how the female hormones mirror the nature's cycles, and when you phrased it like that, it hit me in a different way today after how we've been speaking about these things. And I've never specifically thought of the hormones specifically related to that. Some more generalized things, absolutely, but it really, for me, I'm finding at this stage in my life, in this life chapter, that bringing in all of these, both, holistic, like, actually, I want to go even farther than that, like just a very spiritual side, to
Mm-hmm.
then connecting the very science driven data piece. I'm finding it is just, it's kind of telling me things that I feel like I already knew in my body, but I
Yeah.
wanted to see it out in the world. Like, I wanted someone to say, yes, this is a thing, and I think that is incredible. And that's definitely something where I'm at, for sure. And I can tell because my mind is always searching for those connections now. They're always at the forefront, and I'm like, ooh, that's potent, that's powerful.
Mm-hmm.
So that's fascinating. And one of the things that you mentioned too is that lines up with the folk myth that I was going to say, and I started to get a little confused, is that there's this old folk myth that if your period aligns with the full moon, that you are in a mothering stage of life. And I think in this context, what it was probably referring to is that you would have been ovulating during the
Mm-hmm.
full moon, in which case that would make sense. And there's so much science behind how much more supported you are energetically and fluid wise to become pregnant during a full moon. So I really like that connection. This is something
Yeah.
I love, oh my gosh, I love your passion and your excitement. This is very healing for me in my stage of life with the things that I have ongoing for me. So I feel like I'm having this like amazing personal session. It's wonderful. Thank you.
I'm really glad that you can relate to it. And I think it's conversations that I'm having so much more frequently now, with friends, with clients, with colleagues, with random people that I meet. Everyone is interested in it, and it's as we spoke about earlier. This subject is so taboo and so unspoken about, and that is changing, and it needs to change. But you wouldn't know that your colleague at work, your friend is suffering really bad with PMS, changes in their cycle, because they don't tell you, they don't talk about it. But they're probably suffering with what you've suffered with, and then they know someone that's suffered with something else, and it's something that it affects us every single day. But we go through it blindly, and it's almost like we're really working against the tide here, and understanding your cycle, working with it means that you can just kind of flow with the tide rather than trying to swim against it.
Yes. Yeah, and we need more of that. We need more of that in this world that we live in our daily lives. And I think that people are really going to love this workshop. I want to just make sure that everybody knows a couple of things. So Alice's workshop is Empower Your Cycle, Practical Tools for Hormonal Harmony. And it's on Monday, January 27th at 2 p.m. Eastern Time or 5 p.m. UK time. Is that
7
correct?
p.m. 7 p.m. UK time.
7 p.m. UK time. I have included a time converter in the link. So the link to the event will be in the show notes, and you can always convert to your time zone wherever you're tuning in from. There's also a replay that will be available. So if you are not able to attend live, this, I can already tell, is going to be packed with resources and tools that you're going to want to have to implement in your own life. And I'm so excited to be offering this. So, Alice, thank you so much for being here today and for sharing all of your wisdom and your enthusiasm. Your enthusiasm, oh my gosh, I love it. I that's why we're here.
I'm
That's why I
excited.
created
Yeah.
Wild Radiance Collective. That's what I want people to feel, is that. And you just brought it. And um, I agree that this
Yeah.
is a really important topic, and on a personal and collective level. So I'm really appreciative of the work that you're doing.
No, thank you so much for having me. It's as you can tell, it's this I am so passionate about getting the message out there and helping women to take charge of their health and not just let it kind of not fall apart, but let things kind of slowly go wrong and deal with more and more symptoms while they're being told that it's either in their head or that, okay, here's the medicine, and just actually taking charge and recognizing that actually I should feel better than this. This isn't normal. It might be common, but it's not normal. So yeah, just being able to get the word out about that and help as many women as I can. Yeah, so thank you so much for letting me come onto your podcast and do so. If there is anyone that has any more questions or wants to inquire about working with me, then my probably best way to reach me is on my Instagram, because that is also where I put loads of interesting bits of knowledge and speak about all of the stuff we've been talking about today. So my Instagram is Alice in Wellness. And from there, on my link tree, you can find my website, how to book a session with me and everything as well.
Fabulous. And I'm going to include all of those links in the show notes below. So you'll be able to go right over to Alice's Instagram. And I do encourage you to start following her. She's got wonderful content, and her link to her website will also be in here. Definitely, I mean, gosh, I feel like I just booked my first free call, and this wasn't even personalized. Like, this was phenomenal. So I think definitely go book a call with Alice and start chatting, especially if you are experiencing issues, if you are having trouble in, with advocacy in what's going on in your life and talking with your doctors. Like, find people like Alice that can support you, because she is an excellent bridge and is so important. And your health is too important not to have that kind of support. So definitely do that. Thank you again, Alice. I'll talk to you
Thank you
soon.
so much for having me.